Good day, everyone. Eco Alt blog is live at Sheraton Hotel, Ikeja, for the official launch of National Research Ethics Committee e-portal by the Honorable Minister of State for Health and Social Welfare, Dr. Tunji Alausa. The NHREC, in partnership with the United States Center for Disease Control, is aimed at contributing and enhancing the medical health data collection and pathological research in Nigeria. Therefore, Eco Alt blog is bringing to you live footage of this event as it unfolds. I am Taiwo Idowu, reporting for Eco Alt blog. In the past few days, Eco Alt blog has been on the trail of the Honorable Minister of State for Health and Social Welfare, Dr. Tunji Alausa, to expressly capture and document the recent trend in the Nigeria health sector. On this occasion, the federal government on Friday in Lagos unveiled the National Health Research Ethics Committee (NHREC) electronic portal in a bid to improve the state of health research and empirical studies in Nigeria. The National Health Research Ethics Committee (NHREC) in Nigeria, in partnership with Public Health Information, Surveillance Solutions and Systems Physics 3 as a technical partner, developed the electronic portal and the website with support from the United States Center for Disease Control and Prevention. The NHREC e-portal is designed to streamline and modernize the ethical review and approval process for health research proposals. Associate Director of Science at the US CDC, Dr. Adeola Adeyeye, took to the stage to commend the swift development of the platform within 6 weeks, noted the smooth collaboration between the Nigerian government and international partners. She said the platform would significantly shorten approval timelines, fostering local and international research partnerships.
Ladies and gentlemen, I am so proud of this collaboration. It's a testament to the fact that, indeed, teamwork makes the dream work. Again, in 6 months, average to get this done. But here we are today, in 6 weeks. A collaboration between the United States Center for Disease Control and Prevention, the Office of the Honorable Minister of State for Health and Social Welfare, the Federal Ministry of Health, NHREC, Phase 3, and all the good people that I cannot begin to list who have directly and indirectly contributed to us being here today. And I will not forget the very able yet gentle leadership of the chair of NHREC, Professor Adebola. In his gentle manner, he will say, okay, this is what we need to do. In a very gentle manner. And I would say that I'm very proud to stand here before you today, and I wish everybody a good launch. And I look forward to what this platform will do in transforming health research in Nigeria.
As Dr. Alausa commended the United States Center for Disease Control and Prevention for their assistance in developing the platform, he stressed that the platform aligns with global standards and its focus on protecting participants' rights, dignity, and safety. The e-portal is designed to centralize and simplify the submission process for research proposals, reducing delays. Continuing, he stated that the latest innovation would enhance Nigerians' competitiveness in the global health research arena, paving the way for data-driven innovation and advancement in clinical practice. The platform's launch builds on the success of the National Strategic Meeting on Health Research Development and Innovation held earlier this year, further underscoring the government's commitment to research-driven healthcare improvements. Before now, the submission of research protocols to NHREC was done manually, and this method caused inefficiencies, delays, and low visibility as concerns progress made by researchers on their submitted documents. The new e-portal will eliminate such issues and reduce the use of papers, as well as streamline the protocol submission, review, and approval processes.
As we move forward with this platform, let us remember that our collective success depends on continued collaboration and partnership of all stakeholders, researchers, institutions, regulators, and our international partners. I must commend His Excellency President Bola Ahmed Tinubu, GCFR, for his visionary leadership and commitment to elevating the health sector. His dedication is evident in the ongoing efforts to reform our healthcare infrastructure, improve workforce capacity, and enhance service delivery. This commitment inspires us all to continue working tirelessly to fulfill the goals set out in the Renew Hope agenda to ensure that our healthcare system is equipped to meet the needs of every single Nigerian. Once again, I would like to thank the US CDC for their invaluable support, as well as their technical partners, especially Phase 3, who helped bring this platform to life. But more importantly, the chairman and members of the National Health Research Committee, who have worked tirelessly to change the narrative of research ethics since their inauguration about a year ago. Together, we're not just launching a system, we're building the future of health research in Nigeria. Thank you all. God bless Lagos State, and God bless the Federal Republic of Nigeria. Thank you.
The Lagos State Commissioner for Health, Professor Akin Abayomi, who endorsed it, takes to the podium and stated that the new development will make medical research as easy as running a business. It's designed to protect participants' rights and intellectual property while still speeding things up for teachers, he added.
Patients. Research is moving more to the genomic and to the proteomic levels, and these are really advanced technologies. Research is becoming very complicated now, and when we have our research ethics committees, I think it's important not only that we do what we're doing here today by speeding up the process of approval so that the ease of doing business in our context of research and development is advanced. There's nothing more frustrating than to submit a protocol and wait 6 months, 9 months for your approval to come through. That discourages international collaborators, it discourages partners, it discourages donors. So if we can get approvals coming through very quickly, I think that's very important, and the context of that in this setting is that we have transformed or translated that to an electronic portal. So I'd like to congratulate all those that were responsible for doing that in record time. That's amazing what we just heard, that it took you 6 weeks, what could have usually taken about 6 months. When I talk about the change of the types of research we're doing globally, we're relying now on very advanced technology. Researchers are looking for genomic footprint of diseases. They're looking at big data. They're looking at ways in which we can understand the relationship between disease, a disease process, the genomics of the individual, and the genomics of the ecosystem around you. So it's getting very complicated and moving at a very, very fast pace. And Nigeria and Africa need to keep up with this. When we talk about types of ethics now, ethics, consent, before you can do any research on human beings, you need consent and permission from an ethics committee. It's a basic human right. But the consenting processes are sort of evolving. We used to talk about informed consent with specific reference to a disease pattern. But because we're looking at now the concept of broad consenting means that you've collected a sample for a particular research, and at the end of that research you don't destroy the samples, but you actually keep the samples in a biobank, and you allow other researchers to have access to those samples and to the data that's associated with those samples. That is really a very advancing paradigm, and it's making research move faster, it's making research cheaper, because you can imagine if there are cohorts of samples with associated good clinical data in various biobanks around the country, that you can just come in as a researcher. You don't have to go back into the field to collect your samples and to collect your data. You can use existing samples and existing information associated with those samples. But there's a caveat to that, because for us in Africa, the use of broad consent, once it has passed through the first stage of ethical granting, could expose us to being exploited, because those samples and that data could be picked up by researchers around the world that have much more advanced technology and ability to apply computational analysis to your data and come up with discoveries that you don't even know about as the original contributor of the sample and the data. So this kind of technology we now need to be very wary of in Africa, that we're not subjecting ourselves to further forms of biopiracy with the rest of the world. So for us, there was a consortium called the H3 Africa, the Human Hereditary Consortium. I think Professor Olakbade knows all about that study. It's almost 10 years now since we started that research consortium on the continent. It has built a lot of capacity, a lot of technological capacity, but it still revolves around the concept of appropriate ethics consenting and benefit sharing. So once you've gotten your permission on a broad consent basis, and this is something that we need to pay attention to.
Also, the project director of Physics 3, Mr. Onimode, who listed the benefits of the platform, recalled that before, researchers had to carry around stacks of paper to get approvals. He gave an example of researchers in Majiguri who used to send their documents to Lagos for approval. Now, they can do it online in real time.
Department of Defense and Center for Disease Control, members of press, ladies and gentlemen, distinguished guests. On behalf of the Permanent Secretary and the Director of Plan of Research and Statistics, please, with all great pleasure, to give this opening remark at this important launch of the newly developed electronic portal for submission and approval of research application. I want to say that the launch is the climax of our collective effort over the past 6 weeks, what I would call a remarkable feat for us to be able to achieve this laudable goal. The project is very close to the heart of the leadership of the Ministry of Health because of the potential of having this in facilitating and improving the process for submission, approval of research application in the health sector. I would say that this feat is part of the ongoing digitalization of the healthcare system, which we all know is in line with the present government of President Bola Ahmed Tinubu, GCFR, to achieve renewed hope agenda in the health sector. This initiative will not only facilitate and improve the process of submission and approval of research applications, but also, among others, improve information sharing and better collaboration within NHREC members to achieve the goals and the objectives that we set, and also enable research applicants for them to be able to track the progress of their submission in real time. Just to say that since the inception of this new committee on NHREC, it has been able to approve a total of about 120 protocols over the last 6 to 7 months, which I believe is something that this new platform will be able to even improve further. At this stage, I would like to appreciate everyone that have contributed to this development. I want to say that what we just demonstrate is what we call a collective togetherness in terms of achieving any goal that we set. And I want to say appreciation to the US government with the CDC and also the technical partner, PHIS-3, for developing this e-portal despite the limited time set aside in achieving this laudable goal. I wish to thank them also for the training that were given yesterday to everyone that was present, which we believe is educative, illustrative, and is productive. And we believe that this will be able to build the capacity of everyone, necessary knowledge to operate this e-portal. Again, we like to say it's a commitment of all stakeholders, and we believe that this is going to remain evergreen in our memory as a demonstration of collective effort in Nigeria. I want to wish every one of us a successful launching. Thank you, and God bless.
Moving on, there was a question and answer session as questions were raised concerning the need for more awareness creation about the functionalities of the platform as well as its usage to academicians and practitioners in the health sector. Responding to the questions from the audience, a member of NHREC, Professor Oliver Ezechi, explained that the portal was for researchers. He said the old ways of doing things raised security concerns, adding that things would be better done with the new platform and research outcomes would be safer.
Depending on the level of the risk, that is sorted out by the chairman. And those ones, like educational evaluation, that doesn't require, is much more than low minimal risk, will just have their exempt. But those ones that have more than just minimal risk, but do not involve more than risk we expect in everyday life. Like we are living from our homes, coming to this place, there's a risk to that. So those ones that are low as that and vulnerable population are not involved, will go through expedited. But once vulnerable populations are involved, children, pregnant women, or is more than minimal risk, it goes to full committee reviews. And the chair of the ethics committee sorts out 2 reviewers, usually an in-house or an expert from outside. If you don't have an expert on that particular area in-house, he identifies one expert in that particular expert and send it for scientific review, while the other members of the ethics committee looks for the ethics of it. And essentially that's why you have the various groups represented in the ethics committee. You have the Christians, you have the Muslims, you have the traditional. Everybody is present to make sure that once the protocol is conform with the culture and sociocultural context of Nigeria. Once that is done and sent, and the reviews come back, if the reviewers come back and say this met all the requirements and there's no issues, the chair sent to the secretariat to issue an approval. But there are issues that need to be addressed. The chairman compiles them and sends to the researcher or investigator to address them. And once it's fully addressed them, an approval is given. The turnaround time before now is 90 days. You know, most expert reviewers are very busy. Imagine sending a protocol to Professor Fumi Olopode, who is very, very busy. He wants to review that protocol, but because of the work, he might not be able to turn around that 90 days. And so this actually takes 90 days according to NHREC code. But what have happened now, with this new digital tool now, is going to revolutionize what's going to happen. Submission, we are here yesterday, and I confess to them that this is a very smooth process. You don't have to be a computer wizard to be able to navigate through the portal. It's very simple. You upload your protocols, and that ensures transparency. It's going to ensure speed. It's going to ensure, I'm sure the ethics committee members are going to like that. And we want to, on behalf of the other committee members, to appreciate the Honorable Minister of State for Health, and then let me know CDC for ensuring that this happens. I told Lola yesterday, I said this is actually going to be a landmark in review of ethics committee protocols in the country. Thank you, sir, for all you do. On behalf of members of NHREC, we want to thank you for appointing us, and we will assure you that we'll do the job you give us to do. Thank you, and God bless you.
In conclusion, the event came to a close with a group photograph session and light refreshment as interviews followed shortly after. I am Taiwo Ido, reporting for Eco Alt Blog.
Very good, and I'll accept the congratulatory wishes from yesterday. Today is another victory, another win for our country.
in improving our healthcare delivery system in Nigeria, in meeting the mandate, the promises that President Bola Ahmed Tinubu gave to Nigerians when he was campaigning, that he would ensure that every single Nigerian gets meaningful and comprehensive healthcare. We're seeing all the benefits of what the president is doing already. He funded us with a very robust budget for the Federal Ministry of Health. This is the biggest budget we've ever had for the health sector in a very, very long time. So I really like to thank the president for his benevolence, for his dedication in advancing the cause of healthcare delivery in Nigeria, and also for everything he's doing for the health sector in our economy. Yesterday, we converted. You saw the memorandum of understanding that the Federal Ministry of Health signed with the Governor of Lagos State, Governor Babajide Tinubu, in converting Akpe General Hospital to FMC. Today, where this is another big leap forward in improving the healthcare delivery in our country. We've just launched the National Health Research Ethics Committee e-portal. And what does this mean? The e-portal now gives researchers the ability to, within the seamless of where they are, to log on and submit their clinical research protocol to be a process reviewed by our NHREC team. This is a big change in our healthcare system. We need to see research beyond academic work, beyond improving our healthcare delivery system, beyond granting health equity to our people, but also as a business and also as a vehicle to significantly improve employment opportunities for our young men and women, and also to develop the extensive human capacity that we have in the country. We're now going to be building new researchers, giving them skills they need to compete worldwide, giving them skills to innovate and be international researcher. This NHREC portal that we've just launched today, it's the beginning of making this entire research ecosystem very seamless.
So we're here at the launch of the National Health Ethics Research Committee, courtesy of the Minister of State, Dr. Tunji Alausa. I think what we're doing here today is to launch the e-portal. The whole idea is to make the process of submitting your research protocol for approval from ethics committees a faster process. So the whole idea of this is to help our researchers speed up the process. It's like ease of doing business in terms of the medical research environment, so that as you submit your protocols, you can't do any research without permission from an ethics committee. These are the kinds of governance we have in place to protect our citizens, so that we are not conducting unethical research protocols. So every research that's done, human research that's done on Nigerians anywhere, whether it's in Lagos, Abuja, or any part of the country, it has to be submitted through an ethics research committee to get permission to proceed with your research on human beings. We do this to protect the rights of citizens. Simple things like making sure that your name is not exposed to the public when you're publishing your rights, when you're publishing your findings, that you're not exposing individuals or communities to any kind of stigmatization. We also it tries to protect the intellectual property of the researcher by protecting his data and his samples, and how the information is published and presented to the public. So the ethics research committees are very, very important committees when it comes to human research. And what the Minister of State for Health is doing here is accelerating the process so that Nigeria can speed up its time frame between submission and receiving approval, so that our research projects can move along faster. When we talk about research, we often talk about research and development. It's called R&D. So without indigenous research in Nigeria, we're not likely to be able to add the D to R&D. And that's how developed countries advance in technology, because they're constantly getting funding to do research in the academic centers, in the government ministries of health. And that's what builds a nation's technological strength. So by speeding up the process for our researchers to get their approval, so that they can get their funding, so that they can carry out their research, submit their findings back to the research committee in good time, get approval so that they can publish their findings and drive the innovation and development part of R&D, that will mean an acceleration of Nigeria's ability to enter the global space of innovation and technological development, which contributes to the bioeconomy, which contributes to employment, which contributes to the GDP of a country. So this process is very critical for us in the health sector, and we're very grateful to the Minister of State and to the sponsors of this occasion, the American CDC, that we're able to launch the e-platform and to help our researchers move along faster with their interest in advancing their research protocols.
So the importance of the NHREC, which is the National Health Research and Ethics Committee, is to ensure that we have a proper regulatory or ethics committee that reviews all the research protocols that come into the country. And so the portal is part of the digitalization of the operations of NHREC. Is an initiative that was started by the Honorable Minister of State for Health, Dr. Tunji Alawasa, and was entrusted into my hands to actualize. And so with the help of our partners, the U.S. Centers for Disease Control, we're able to set up this platform to help in improving the efficiency and the efficacy of NHREC. So the process currently, prior to this, was taking a significant amount of time, more than the 90 days that we had hoped for, and it was a manual process. So a digital process, digital level 0, and now we're at a digital level 4. So that's going to significantly increase and efficiency, but more importantly, reduce the turnaround time in which people submit protocols for approval and then get their responses back. And so it just improves everything that we do in the research space for healthcare. So it was actually, like I said, brainchild of the Honorable Minister of State for Health, part of the digitalization of our operations to increase efficiency. But more importantly, it couldn't have been done without the support of our partners. I reached out, myself and the NHREC chair, Professor Adegbola, reached out to the U.S. Centers of Disease Control, actually to ask for their support in actualizing this, because we know that it was a significant effort, and they came through. And they gave us a response, and within 6 weeks, which we thought was unheard of, they got an implementing partner called PHIS-3, and we worked diligently day and night to work together with the Federal Ministry of Health team and the Office of the Honorable Minister of State, the NHREC chair, and just a number of stakeholders to design what we needed, and some other people that had worked prior to design what we needed, and basically have several meetings back to back. And it came to life. You know, we thought it wasn't going to happen because we had such a short turnaround time, but significant effort from all sides, specifically from the US CDC supporting our vision and our mission. Yeah, so it's going to go live. So it's been launched today. There's still things that we're doing at the background to make it really robust and useful to the public, and clean all the kinks and remove all the bugs. And so soon enough, there's going to be some more PR and educating the public on how to use it, and training and things of that sort for other stakeholders. But stay tuned. It's going to go live to public in the next few weeks. We're just working to make sure everything is as perfect as it can be. So thank you for your interest, and thank you for being at the launch. Thank you.
The United States Centers for Disease Control and Prevention is the sponsor of this NHREC e-portal. So we provided support to the Federal Ministry of Health and the Office of the Honorable Minister of State for Health and Social Welfare to be able to have the National Health Research Ethics Commission have this e-portal through which they can have more facilitated review of their protocols. That's a really interesting question. If you understand how the NHREC review process works, researchers submit protocols to NHREC for ethics approval, and prior to now, it was all done through a manual process. So it then means that now going forward, that when there is any disease condition or an outbreak that needs quick review by the ethics committee, this whole process, by having the electronic platform, expedite that process, facilitates this, such that you have a quicker review, ethics review of any type of disease that is being researched nationally in Nigeria. And the downstream effect of that will be that researchers can quickly hit the field once they have the ethical approval for their protocols and quickly implement innovative measures that can save life quickly. Because if something is held up through in the ethics approval, that would affect how researchers can quickly provide interventions, especially if it's a new kind of intervention. So the e-portal is going to be on the NHREC website, which means that the average researcher from any part of the world is going to be online, the portal. So it's going to reside. There's going to be a link on the NHREC website whereby anyone from anywhere in the world that has access to the internet can pretty much click on and access that portal. And the portal also has another standalone that you can access it through, but it's all going to be web-based, which means that people can access from everywhere in the world where they have internet connectivity, which is pretty much everyone these days.
As we conclude the NHREC e-portal launching, you would agree with me that the portal is going to give researchers seamless and swift research experience. Please don't forget to follow us on all our social media platforms and subscribe to our YouTube channel at EcoAltBlog. I am Taiwo Idowu, reporting for EcoAltBlog.